Dr. Tinkran, on this part. And I want to start by sort of getting your own views on, for nurses and midwives in this country. We had the detailed issues that Kwame put out. What are the key issues for you that you want to see the manifestos address?
All right. Good evening to you. Good evening to my brother and Dr. Ayok on the call and your viewers. Of course. I mean, I listened to Kwame, and that I'm really impressed about what I saw and what I read. I got the opportunity of reading through aspects of his studies before coming to the studios, and I think that he has unpacked the issues. Now, coming specifically to nurses and midwives, I mean, if you look at the Ghana Democratic Health Survey 2022, the things that they've put out there, it boils down on those who are actually taking care of the people. If you are talking about malnutrition, if you are talking about mortality, maternal mortality and all that, there are people who are providing those services. So what we did as part of our strategic engagements with government and, of course, with various opposition parties is that we had opportunity in 2020 of meeting Mr. Mahama. We gave a position paper on most of the health needs of our people. And likely, recently we met the NDC Manifesto team, Manifesto team, and we have given them broad areas of concern that we think that if they pay attention to.
Bullet it for me. What were those issues?
All right, so we looked at, if you like, education and research as far as nursing and midwifery is concerned. And we felt that research is abound with how baccalaureates, highly trained nurses and midwives, has the propensity of reducing mortality. 10% increase in baccalaureate education of nursing is able to reduce mortality by 10.9%.
What's the current picture?
The current picture is bizarre. In Ghana, nursing is the only profession in Ghana that we have 3 levels of entry. Okay, almost 60% of our nursing workforce are auxiliary, and we think that that's not the way to go. We think that majority must be degree prepared. So we have to cancel certificate programs, we have to cancel diploma programs, and train nurses and midwives at a degree level.
That's bold.
Precisely.
Cancel certificate programs, cancel diploma programs, and just do Bachelor of Arts.
Bachelor of Nursing degrees. Exactly.
Bachelor of Nursing, sorry.
Yes,
Bachelor of Nursing degrees, and then you do the Masters and onwards.
Precisely.
That's bold.
Yes, it's a bold decision, and we need to do that. When you go to next door Nigeria, anybody practicing as a registered nurse or midwife has a first degree. That's where it starts.
Nigeria is doing it.
Precisely. And we could do better than them. All right. We have the human resource, we have the schools that can do that.
And